I'm Dr. Brian Humphreys. I'm here to talk to you about allergies and how they affect your health. Allergies are very important in the 21st century. Things that we breathe affect our airway and sinuses. Things that we eat affect our whole body. Things that we come in contact with can affect our skin and other organs. The control of these allergies is very important to one's well-being in the 21st century. Allergies are caused by immunoglobulin E. It is actually a malfunction of the immune system. Immunoglobulin E, known as IgE for short, is really there for a purpose. In reality, IgE will fight malaria, worms, parasites, intestinal nematodes. But this is 21st century America. We don't have those things in our lives today, not to a high degree. The IgE then gets into mischief, attacking innocent bystanders such as the pollens, the allergens, the things in our diet, making us sick. The IgE does not know the distinction between what it should attack and what it should not. When IgE and the immune system becomes involved significantly, there is a detriment to our health. These angry attacks can be violent, and the body itself will respond violently as though it is really sick. In East Texas, there are a lot of things in the air. Most of the time when we think of allergies, we think of things in the air that we are breathing and make us sick. Indeed, out here in this part of the world, we've got trees, we've got pollens, we've got molds, we've got grasses, weeds, animal danders, things that are environmental and industrially produced, and many of these things affect our allergic health. If you are allergic, it usually means that you have a high level of immunoglobulin E, again, IgE for short. Pollens that enter the respiratory tree then become affected. The IgE will attack the pollen and produce an immediate immunologic inflammatory reaction. This is an allergy. Some of the first symptoms that develop are swelling, obstruction, a large amount of rhinorrhea. That means drainage from the nose. This drainage can get into the front or the back of the nose. When it drains down the back, it can produce other symptoms, like inflammation of the throat. The enzymes in this inflamed drainage are very active, and they can act like acid and irritate the throat considerably. They also can irritate the larynx, producing laryngitis. Up to 1 liter a day is normally produced of mucus from the back of the nose. Allergies can produce up to 3 liters a day. That's almost 3 quarts of mucus that's coming into the nose, from the nose and coming down into the stomach, giving the person a sensation of nausea and stomach upset. The lungs can also be affected. And indeed, we understand today that the initial inflammation of asthma, bronchitis, upper respiratory inflammations may also involve allergy and the allergic reaction. In my practice, we see many people with trouble in the sinuses. This is a picture of a sinus in various stages of being sick. In fact, this first picture demonstrates normal sinuses. As the cascade for illness begins to occur, one can see that the allergic reaction is the first reaction to occur. Inflammation, swelling, and obstruction of the outflow pores follows. Infection can then come in, creating an acute infection followed by the chronic infective state. Usually in diagnosing the allergies, a skin test will be used or a blood test can be used. Both have advantages and disadvantages. The skin test is immediate. However, we use the needleless technique where no needles are applied to the skin, thereby avoiding the 200 pinpricks that allergy testing is usually known for. Plastic applicators now will apply the antigen and give us very accurate diagnoses. The alternative is the blood test, called RAST, Radio Allergosorbency Test, RAST for short. This blood test is done at the National Lab. A simple blood sample is sent, and the lab can tell us all of the allergies in the air that the person reacts to from the blood sample. Both tests are very well covered by most insurance plans. Both are very accurate in diagnosing your inhalant allergies. Particularly with upper respiratory allergies, there are 3 ways to treat these. The first is avoidance. For example, if you're allergic to attic dust, don't go into the attic. If you are allergic to grass, don't mow your lawn. Nonetheless, this is East Texas, and this is the real world. We can't live in a bubble. If you're allergic to very common things that are in the air, such as pine pollen, such as common dust, such as one of the common trees that we have here, oak, elm. If you're allergic, you can't necessarily avoid it every day. That leads us to the second way to treat allergies, and that is medications. Medications usually involve steroids, usually involve antihistamines, and anti-leukotrienes. These three main classes of medications are very good. Another class of medication are decongestants. Decongestants eliminate the sense of stuffiness in the nose and sinuses. The final way to treat allergies is to make the person immune. Natural immunity is the best resisting factor. These immune shots are given on a weekly basis. When you were young, you got all the normal immunizations that were necessary to polio, to diphtheria, to tetanus, all those other diseases that we wish to avoid in the 21st century. These shots, to make you immune against your allergies, work the same way. However, if you were to get the shot all at once, it would be a shot that big, and it would probably overwhelm you. So we do not give allergy injections in that manner. We break them up into very small doses, a little bit of which is given as a booster every week, until the natural immunity then sets in. Studies have shown that immunity begins setting in relatively quickly, and more long-lasting immunity will begin to occur at 75 weeks. That is about a year and a half of allergy shots. Allergy testing and allergy immunotherapy, also known as allergy shots, do have side effects. The most common known side effect is an allergic reaction. These are serums that are produced in order to make you slowly allergic to exactly what you have your allergy to. These antigens are then given in the shot to immunize the patient. The antigens are what induces the allergic reaction of the immune system. Serious reactions include anaphylaxis and even death. Because of these severe reactions, allergists have always given allergy shots in a very safe regimen. They dilute some of these antigens out to 1 to 1 million, an extremely dilute serum. Your 1 to 1 million will be given for a year in that scenario. However, if you're allergic at a 1 to 500 level, that 1 to 1 million simply doesn't work for you. After a year, the allergist will advance that to 1 to 100,000. In the third year, 1 to 10,000, and then 1 to 1,000. And it may be the fourth or fifth year of getting shots that you will get your 1 to 500 where you need to be properly treated to get your relief. New technology, however, allows us to get right to the 1 to 500 so that it is not a matter of years, it is now a matter of months, 8 to 10 weeks before your proper immune level is being delivered. These newer techniques are a bit more aggressive, but very safe. Not all of these immune treatments need to be given by shots. For people who are very sensitive about needles or very young children, these drops can be given as sublingual. That means little drops under the tongue without a shot at all. Newer studies are beginning to show that 90 to 95% effectiveness is achieved by use of the sublingual drops as opposed to the injections. This will totally avoid the use of needles at all. In terms of treatment, normally I will recommend a combination of some of these different therapies: avoidance, medication, immune therapy. In addition, a combination will involve a regimen that I feel will be best to treat your condition.